Welcome to the Total Knee Arthroplasty Revision class presented by me, Caroline Bean, from Johns Hopkins Howard County Medical Center. Today, we'll cover the differences between your original knee surgery and revision surgery, what to expect before, during, and after the procedure, and who to contact once you're home. There are several reasons why a knee revision might be necessary, including infection, loosening, instability, stiffness, or a fracture. For more details, you can visit the AAOS Ortho Info website. Revision surgery differs from your original procedure in several ways. Depending on your situation, you might continue antibiotics at home, have different weight-bearing restrictions, wear a brace, or have a different bandage. All these details will be clearly explained in your discharge instructions. Planning for your return home is important. Prepare meals ahead, identify a caregiver or coach to assist with transportation and check-ins, and make your home safe by removing rugs and cords. Night lights are helpful, especially for trips from bed to bathroom, and if you have stairs, try to stay mostly on one level for the first week. Also, arrange help with pets and household chores since you'll be using a rolling walker. Before surgery, please see your primary care provider within 30 days for clearance and any specialists within 3 months. Dental clearance is also required within 6 months, except for full dentures. To prevent infection, you'll apply mupirocin ointment inside your nostrils twice daily for 5 days before surgery, stopping if you have any irritation. Instructions are in your patient booklet. You'll also use Hibaclin's wash for 3 showers starting 2 days before surgery. Follow the provided showering instructions carefully. 7 days before surgery, stop all herbal medications, NSAIDs like aspirin and ibuprofen, and vitamins. Continue other prescriptions unless your doctor says otherwise. Blood thinners like Xarelto or Coumadin should be managed by your physician. If you take certain GLP-1 agonists weekly, hold them 1 week before surgery. Daily GLP-1 agonists should be held the day of surgery. After surgery, be sure to consume protein shakes to support recovery. Tylenol is safe to take before surgery, so you can continue using it as needed. On the day of surgery, don't eat or drink after midnight except for 20 ounces of clear liquids up to 3 hours before your arrival. Avoid milk, cream, alcohol, gum, and purple or red drinks. Gatorade is encouraged for hydration and electrolytes. Bring your photo ID, insurance cards, loose clothing, dentures, hearing aids, glasses, and a list of medications. Only bring medications if instructed, and keep them in their original bottles. Leave valuables at home. Arrive at least 2 hours before surgery, park in visitor parking near the main entrance, and check in at the admitting desk. You'll then go to the preoperative area for final preparations. In the pre-op area, you'll change into a gown, review medications with the nurse, and start pain management with medications like Celebrex and Tylenol. You'll meet the anesthesiologist to discuss anesthesia options, usually spinal or epidural, which help you recover faster and avoid intubation. The surgeon will mark your operative leg and answer last-minute questions. In the operating room, expect a busy environment and to feel cold. Surgery typically lasts about 2 hours, and your surgeon may inject numbing medication around your joint for pain control. After surgery, you'll spend at least 2 to 4 hours in the recovery room with IV fluids, heart monitoring, and ongoing pain and nausea management. Once stable, you'll either go home or to your inpatient room. Our goal is to get you out of bed the day of surgery. Your weight-bearing status may vary from full weight-bearing to toe touch or non-weight-bearing, and your surgeon and physical therapist will review this with you before discharge. Physical therapy usually starts 2 to 4 hours after arriving in recovery, once you can move your leg. You'll sit up, stand, walk, practice stairs, and learn exercises, so it's important your care partner is present to help you remember instructions. If you're an inpatient, you'll be on the Joint Academy unit with private rooms and bathrooms. Nurses will orient you, check on you every 2 hours, and manage your pain. All our inpatient rooms are private and include private bathrooms for your comfort and privacy. While in the hospital, you'll be encouraged to walk to the bathroom with staff assistants, sit up for meals, and spend most of your day in a reclining chair to aid recovery. Pain management includes scheduled medications like Tylenol, Celebrex, and gabapentin if under 75 years old, with narcotics available as needed. Always notify your nurse if pain increases, and follow your surgeon's instructions carefully without changing your regimen on your own. Staying hydrated is crucial. Aim for 64 ounces or more of water daily unless your doctor advises otherwise. Dehydration can cause low blood pressure, dizziness, fatigue, and muscle cramps after surgery. Blood clots are a risk for 30 days post-surgery. Watch for signs like redness, warmth, tenderness, or swelling in your calves. Prevent clots by walking frequently, taking blood thinners, and using a DVT pump if recommended. Common blood thinners prescribed include aspirin, Xarelto, Eliquis, or Lovenox injections. These are usually taken for 30 days after surgery. Always take them as prescribed and keep moving to reduce clot risk. Your surgeon may recommend a DVT pump for home use. It helps prevent clots when you're sitting or lying down, especially during the first 10 days. Use it as much as possible, including during sleep, for up to a month. The DVT pump comes with instructions and warnings. Using it consistently is key to its effectiveness. Your risk level determines how long and how often you should use it after surgery. You'll receive a rolling walker at discharge. If you already have one, bring it so physical therapy can adjust it to the correct height for you. Some equipment, like raised toilet seats and shower chairs, are not covered by insurance, but can be purchased or borrowed from medical device loan closets in Maryland. A raised toilet seat or bedside commode helps you get up more easily and maintain independence. The commode bucket should be removed when placing it over your toilet seat. A shower chair is another helpful device, not covered by insurance, to make bathing safer and easier after surgery. You'll also receive a knee replacement kit with helpful tools like a sock aid, long-handled sponge, grabber, and shoe horn to assist with daily activities. The hospital will provide an ice machine to help with swelling and pain management after surgery. When using the Breg Polar Care ice system, never apply the pad directly to your skin. Always place a towel or clothing between the pad and your skin. Check frequently for irritation, and use it in cycles of 20 minutes on and 20 minutes off for up to 4 weeks. Your surgical bandage will be a Mepilex dressing that is water-resistant but not waterproof. You can shower 3 days after surgery and will remove the bandage on day 7, following your discharge instructions. In some cases, you may have a wound vac dressing instead of a Mepilex. This device promotes healing and reduces infection risk, and you'll go home with it along with usage instructions. Your incision will usually be closed with dissolvable stitches and surgical glue, which dissolve over 6 to 8 weeks. After removing your bandage, you can leave the incision open to air without covering it. Avoid putting any lotions, ointments, or creams on your incision until it is fully healed, usually around 8 weeks. Don't submerge it in water, but you may shower carefully without scrubbing the area. Never pick at scabs or remove stitches yourself. It's normal to experience bruising and swelling from your hip to your toes for up to 6 to 8 weeks. Icing and elevating your leg will help reduce swelling and pain during recovery. Call your doctor if you have a fever over 101.5, increasing redness, drainage or swelling at your wound, yellow or foul-smelling drainage, or calf pain and swelling. Call 911 immediately if you experience shortness of breath or chest pain. For non-life-threatening concerns like bandage or pain issues, contact your surgeon during business hours via MyChart, phone, or email. After hours, use email to reach out to Dr. Thacker or Dr. Nickel. After discharge, you'll have a follow-up appointment with your surgeon about 4 weeks post-surgery, which should already be scheduled for you. For more detailed information about knee revision, you can visit the American Association of Orthopedic Surgeons Ortho Info website. If you need to reach me, Caroline Bean, you can call my office or work cell or email me at the address provided. Thank you for your attention today. We appreciate your participation and look forward to supporting you through your recovery.